Speaking to the bill.
The gentleman has floor.
Thank you, Mr. Speaker. Mr. Speaker and ladies and gentlemen of the House, HB 2264 interferes with a woman's access to affordable health care, especially vulnerable women. HB 2264 attempts to bar trusted health care providers from receiving public funding because they provide safe and legal abortions, even though those federal funds are not used for that purpose. Once again, under the guise of eliminating the ability to access constitutionally protected medical services, women's access to health care is yet again under attack, and now their health care providers are being targeted as well. We already have what appears to be a dearth of health care providers for women in the Commonwealth. According to a 2012 study by the American College of Obstetrics and Gynecology, 39% of the counties in Virginia have no OBGYN physician. Using this change in funding allocation in order to effect the closure of these health care partners will only increase the already broad range of areas without a sufficient number of health providers, especially low-income women, women of color, and other vulnerable communities. One of the largest health care providers that would be impacted by this legislation would be Planned Parenthood. Their health centers offer comprehensive health care services to tens of thousands of Virginians annually, including family planning services, contraceptive counseling, STI testing and treatment, and cancer screenings. They also provide a broad range of essential preventative and primary care services, including diabetes screening, cholesterol screening, and routine physical exams. Planned Parenthood is one of the few remaining providers that continues to offer consistent and reliable care to Medicaid recipients, and importantly, often serves as a crucial entry point into the healthcare system for these and other individuals. The vast majority of Planned Parenthood patients have incomes at or below 150% of the federal poverty level. Nationally, more than 1/3 of low-income women who receive publicly supported contraceptives receive care at Planned Parenthood. 1 in 5 women will visit local Planned Parenthood centers for health care during her lifetime. And many low-income women, underserved women, rely on Planned Parenthood as their primary health care provider. But let's focus in on Virginia. In 2014, the Virginia's Planned Parenthood health centers served over 22,000 patients, administered 1,935 cervical cancer screenings that detected 260 abnormal results and required further diagnosis and treatment. They conducted 5,424 tests for chlamydia, the leading cause of preventable infertility that resulted in 240 positive results and follow-up treatment. They performed 2,000 breast exams, provided 16,441 patients with birth control services. With nearly 50% of Planned Parenthood health centers providing care in rural or medically underserved areas statewide, there is no ready-made alternative that has the ability to take over the treatment of the communities that are now being served. Taking away funding from health care providers, even this one organization, will result in a widening gap of available health care coverage that will disproportionately affect low-income and rural-based individuals. Now, Mr. Speaker, I'd like to talk about the law a little bit. Under Title 10 of the Public Health Services Act of 1970, Virginia applies for funding from the federal government to ensure access to a broad range of family planning and related preventative health services for low-income and uninsured individuals. It then contracts with the hospitals, local health authorities, and nonprofits in order to ensure people are getting the care that they need. What this bill does is to talk about reallocating this funding away from health providers other than hospitals that provide abortion services, even though the funding is not used for that purpose. We take federal dollars to provide these services. A court has stated a state eligibility standards that altogether excludes entities that might otherwise be eligible for federal funds is invalid under the Supremacy Clause. The federal government does not prohibit health care providers that perform abortions from receiving Title X funds for other family planning services. I would note for the House that similar laws to this legislation proposed in North Carolina, Texas, California, Arizona, and Alabama were all struck down by the federal courts for this very reason. Women deserve access to safe and reliable health care. We should not stand between a woman and her doctor, and we should not cause harm to the vulnerable women in order to achieve a political victory. I ask that this House vote against HB 2264. Thank you, Mr. Speaker.
The gentleman from Williams, Marshall.